Hi, my name is Rochelle Rosales. I will be doing skills video for IV fluid and medication for 266 BSN program, Nightingale. I have my Nightingale uniform on. I have my Nightingale ID. So let's go ahead and get started. Just like anything, we do hand hygiene first, and I'll introduce you what we have here so far. And also going into the patient's room, just like anything, you introduce yourself for nursing etiquette, and also obviously to confirm who they are and so on, and we'll go from there. Okay, so again, we're gonna go ahead and do hand hygiene, then I'm gonna go ahead and put on gloves. Disclaimer, the gloves that I'll be using is not the same as what you guys sent, because the one you sent from the box, my gloves, the gloves that they have is really too big for my hand, so I don't feel comfortable in it, so I'm gonna be using my own. So just like anything, we have our gloves on, and I'm gonna go ahead and tell you what we have here so far. So first we have our primary tubing right here, okay? And then I'll go to all of them. I'll go into all of them. So the primary tubing, secondary tubing, the fluid normal saline, and also the medication that the doctor ordered, which is amoxicillin. So first, I'm gonna go ahead and tell you guys the primary tubing, what's in it and what is it about, and so on. So first, when we open it, just like anything, we have here, we put the spike area, which is, it looks like really big, and that's how it looks like, as a spike. That's what we're gonna put that to our fluids. And then this is where it's gonna go to connect from the patient. And again, since this is our primary tubing, this also has a Y port, which is right here in the blue, okay? And then also we have a roller. This is when you gauge to turn it on or turn it off, okay? Or the range of how we do it. And then obviously this is the hub where the drip is going to be. So just like anything, here it is. Now make sure that there's no kinks when you open it. Make sure that you have everything in here, and then we're gonna go ahead and get started. Okay, so just like anything, we're gonna go ahead and put everything, we're gonna make sure this is locked first, and then we're gonna go ahead and open. This is our normal saline. So before we do that, I just want to make sure that we have our orders here. I did it on my board because my office has a board, so I'm going to go ahead and do that really quick. So first, the fluids that the doctor ordered, just like anything, I wrote it down. So 50 mLs is the order per hour, so that's 60 minutes. And then it's 15 GTT, which is drops per ml. So we just multiply, do our equation here. So 150 times 15 equals 2,250. You divide that by 60, which is the 60 minutes, and then that equals to 37.5. Now, just like anything, drops doesn't do 0.5 just because it's always a whole number. So since it's 5 and over, it's gonna be 38 drops per minute. Again, that is the normal saline, the fluid side. The medication side, we also did the equation. The doctor ordered 250 milligrams, and also that is, excuse me, IV 100 mLs in 15 minutes. And again, this is 15 drops per ml. Again, same concept. We go ahead and do the equation, we cross cancel, and then we're gonna go ahead and have 1,500 divided by 15, which is the 15 minutes. And then that equals to 100 GTT per minute, which is 100 drops per minute. So again, we have 38 drops per minute on the normal saline, and then we also have 100 drops per minute on the medication, which is amoxicillin that is ordered, okay? So now let's go ahead and move on. So again, just like anything, what I said about making sure that we have our orders, we do the 6 rights, of course, well, technically 5 rights, and then 6 rights is documentation. So we have the patient, right? We identify the patient, the medication, okay, which is the medication that we have here, the dose, which we did already, and then the time. Is it now? Yes, the time is now. And then also route, right? We're gonna give it IV. So that said, we need to make sure that the patient, since we're giving them this medication, we need to make sure that they're not allergic to anything, meaning amoxicillin, are they allergic to that? Okay, so that's confirmed already that they're not allergic, which is great. And let's go ahead and get started. So first we're gonna start with the normal saline, which is the fluid. So again, just like anything, we're gonna open this. Again, make sure that the roller is locked, and then we're gonna use this part, this end, to go inside the liquid or the fluid that the doctor ordered. Okay, so that's there. And now we're just gonna squeeze a little bit just to make sure that it's on here. And again, make sure the roller clamp, which I did close it earlier, okay? And so see how it's on there. So sometimes they want it half, but this is good. Okay, again, this is normal saline. Okay, now we're gonna go ahead and prime it. What does that mean? Making sure that it's flowing well. Again, checking if there's no kinks. I'm just gonna open the tip of this and then unlock our roller, making sure that it's unlocked so we can see. And then I'm gonna take out the tab here, the tip. And again, it's gonna spill a little bit, but that's okay. Okay, and then now it's going in. And then we're gonna go ahead and I see it dropping, good. Now we're gonna close the lock. And then we're gonna go from there, okay? So now we're gonna go and hang this up since it's there. I'm just gonna hang this up here. Again, this is 30 inches above the IV site from the patient, obviously, okay? That's here. Okay, now we're gonna do some important stuff, right? We're gonna make sure that this is literally 38 drops per minute. Now we're gonna go ahead and I have my timer on with me, okay? And then I'm just gonna go ahead and count, or obviously the timer is gonna tell me 1 minute, okay? So now we're gonna check to make sure it's 1 minute, and I'm gonna start now. We have 5 seconds. And there's the minute, okay? And now we have that. We have this now. It's 38 drops per minute. So we have that up there. Again, it's 30 inches above the IV site that we're gonna do. Now, we're gonna go ahead and do the medication. So just like anything, we confirmed everything. The patient's not allergic to anything. As far as amoxicillin, we did our equation. It needs to be 100 drops per minute. Okay, so just like anything, we go ahead and take our secondary tubing. And just like this one's a little simpler because it's smaller, meaning it's less, it's not as long. So again, we want to make sure this is closed, the roller's closed, okay? And then again, make sure that it's clean. And then obviously we're gonna take out the tip, and then we're gonna take this out, and then we're gonna go ahead and plug it in there. Okay, and just like what we did before, we're gonna squeeze a little bit so we can have some liquid coming down, okay? Again, not too much. Half is okay. Half is a good. So just like what we did to the primary one, we're going to go ahead and prime it. No knots or no kinks or anything. So we're going to go ahead and do that in the drip chambers. As you can see, it's already doing its job. Okay, so now we're going to go ahead and do a priming, and not too much. It's not going to come out too much, but we just want to make sure that it's doing its thing. Good. Okay. All right, we're gonna go ahead and close it. Okay, so just like the other one, we're gonna go ahead and hang it up. But when we hang it up, it needs to be higher than the primary fluid, which is the normal saline. So we're gonna put it up higher. So we're gonna go ahead and put the pole up higher. It's about like here. Okay, and just like anything that we did from the first one, we're gonna go ahead and time it. And again, this one is a minute. It's technically 100 drops per minute. So it's gonna be a little bit more than the first one. So let's go ahead and check. And now we're gonna go ahead and count for 1 minute. And starting now. Okay, there's 1 minute, and then we have 100 drops per minute. So now that that's connected, and also we know our drip factor and so on, we have it all together now. Now we're gonna go ahead and connect it to the Y port. Okay, so the medication needs to go to the Y port, okay, from the primary tubing. So we're gonna go ahead and get our alcohol, make sure that it's clean. Again, this is going to the white port. Again, this is going to be making sure everything's clean. Okay. And then we're going to go ahead and connect it together. We're going to twist it. Okay. And that's done. Again, we're going to go ahead and make sure that this is unlocked. And also, this is for demonstration purposes, obviously it drip, but we're gonna unlock this to make sure that we are connecting it to the patient's IV, okay? So now this is all set up. This is gonna be connected to the patient's IV. Of course, just like anything, we need to make sure it's taped to the patient correctly and make sure that we put a date, initials, and whatever policy that our clinic has for the patient. And again, this needs to make sure this is above 30 inches above the site of the IV, and then the medication needs to go up higher than the fluids that is ordered. And I think that's about it. Again, observe your patient to make sure they're good, and if they have any questions, comments, or concerns. And that's pretty much it. And after all that's done, of course, just like anything, we clean up our masks. And then we throw this in our garbage parcel. We take off our gloves. And then obviously we do hand hygiene, okay? And again, we can sit here with the patient if they have any questions and so on. And then if not, then we're gonna go ahead and make sure that we can go and come back and observe them all again. If you have any questions, my name is Rochelle Rosales. Again, this is for the IV fluid and medications. 266. Thank you so much. Bye-bye.